Good afternoon, everybody. My name is John Dailey. I'm the mayor of the city of Tallahassee, and I appreciate everybody coming for this press conference today. Today, Governor Ron DeSantis, in consultation with the state health department officials, has recommended limiting all mass gatherings in the state for 30 days. We concur with the governor's decision, and so today I am calling on the community to begin to implement social distancing practices that have proven effective in slowing the spread elsewhere. Practices such as avoid large gatherings. Folks, if you're sick, stay home. Let's practice good hand hygiene, and where possible, employers should allow remote work. We are going to have to change how we do business and how we go about life for the near future. While we do not yet have a positive case of COVID-19 in the Tallahassee community, we do anticipate that we will in the near future. Our main priority is the health, safety, and welfare of our citizens. Now is the time that we need to take appropriate steps to limit the spread of this virus in our community, to ensure that we do not overwhelm our healthcare system, and work to make sure that we protect our provider community. At the city, and you will hear from the county and the school board and our hospitals in just a second, but at the city, we are doing those things as well. We have reviewed and updated our continuity of operations plan. Where possible, we will allow our employees to work from home. For weeks now, we have been operating under enhanced protocols at city facilities, on city buses, and at Tallahassee International Airport. We are a critical service provider in our community, and we are fully prepared to ensure that there are no utility disruptions. We are halting the disconnection of utility services for the next 60 days, including water and sewer. We will provide utilities. As our community addresses the spread of the virus, it is imperative that our businesses and residents have access to all essential utilities. A few events. This weekend's statewide electric lineman competition that is being hosted in Tallahassee will be closed to the public, as well as the ongoing senior games that are taking place as well. The March 25th City Commission meeting will be postponed. Springtime Tallahassee and Word of South, two wonderful events in our community that the city co-sponsors, will be canceled this year. It is the responsibility of each of us to do what we can to take care of ourselves and our neighbors. And while you may be fine if you contract the virus, others with underlying health conditions may not be. For the vast majority of folks who contract the virus, the best course of action is to self-isolate for 14 days. But I have stressed that if you have the symptoms and are concerned, contact your healthcare provider before going to the doctor's office. Contact them before going to the doctor's office or the hospital. And while our daily routines will be disrupted, these protective steps will serve to reduce the spread of the virus, manage the impact on our healthcare network, and enable us to return to normal as soon as possible. The situation continues to change rapidly, and we will continue to adjust accordingly. And on a final note, I want you to know that I stand with just about every elected official, it looks like, in Leon County, and senior staff and leadership at the county, the city, and the school board. We've got business leaders here. We've got the hospitals that are represented here. This community has been fantastically working together as we go through this. Whether it's the organization of Springtime Tallahassee or Word of South or some of the other organizations that are dealing with their scheduling as well, I want to thank you. We're going to go through this together, and we're going to make it together. So what I'd like to do is ask the chairman of the Leon County Commission to come forward for a few remarks, Mr. Bryan Desloge. Following him, we will have the superintendent of the schools, Hanna, and then we will hear from our two hospitals. Mr. Chairman. Yep.
Thank you, Mr. Mayor. I'm Bryan Desloge. I'm the Leon County Chairman of the County Commission. Let me echo some of the comments the mayor made, but we are, nothing is more important to us than the health, safety, and the welfare of the citizens of Leon County. We've been laser focused on this since the January 21st date of the first U.S. case that was reported. And since that time, we've been working around the clock with the Department of Health, the Center for Disease Control, to keep our community prepared and informed. Our emergency management team has been coordinating and supporting this response planning with local educators, healthcare providers, assisted living facility administrators, and first responders. On Tuesday of this week, we activated the Emergency Operations Center to ensure that we were prepared for this public health emergency, much like we have done for recent hurricanes. And while Leon County remains free, as the mayor pointed out, of COVID-19 for now, we have to do everything in our power to make sure it stays that way. And to that end, the governor, the state health experts are strongly recommended today, and the county has postponed all of its large events with more than 250 attendees, including Leon Works, which was scheduled soon. We are strongly encouraging other local event organizers to consider postponing their own events, all in accordance with the state health expert guidance. While this may very well disrupt lives, it also may save lives. But we must continue to wash our hands, cover our coughs, keep up the good hygiene that's been in most of the press announcements. It takes all of us to protect our most vulnerable populations from infection, and our county will continue to convene, coordinate, and support our community's most critical response to the COVID-19 for however long it takes. I'll also comment, Mayor Dailey made the comment about everybody coming together. You see what people are made of in the toughest of times, and I think that people standing behind me here today is a strong indication of how well we work together and kind of community we have. So with that, I'd ask our superintendent of schools, I believe, Rocky.
Thank you, Commissioner Desloge, and I'd like to echo what the mayor and the commissioner said about, as a community, we're all in this together and we'll get through this together. We just have to ensure that we're making decisions based on science and not mass hysteria. As a public school system, nothing is more important than protecting our most precious resources, which are our children, the 33,000 children that we serve each and every day. As of today, following spring break next week, Leon County schools will remain open as normal. Florida State University, FAMU, TCC, and universities across the state made an announcement yesterday that they would self-quarantine or ask students to stay away for 2 weeks following spring break. When they asked me what we were going to do, our situation is a little different, and that was my response. Our students live with their parents, and their parents have jobs and need to go to work, and our children need to be fed every single day. And some of the only meals that our kids are getting are at breakfast and lunch at school. It's a little more problematic when you talk about closing down a public school system that serves over 30,000 of our most fragile citizens day in and day out. To our employees, including our maintenance staff, workers, our teachers, our support staff, and countless others have joined in the effort to ensure that our schools, our transportation system, and food service lines are being sanitized and disinfected at the highest levels possible. And I want to thank members of LCTA, LESBA, or other unions for joining forces. Whether it's in their contract or not, we're all in this together. We're all going to ensure that we're germ-free as much as possible, encouraging our students and our employees to do just what the commissioner said, to wash their hands, to cough into your elbow, and to, if you are symptomatic or you have a fever, to stay at home until those symptoms have passed for at least 24 hours. To our employees, and this is a major announcement from our school system, so pay attention. To our employees and students who are traveling abroad or on cruises over spring break. Again, to our employees and students who are traveling internationally or on cruises over spring break, Leon County Schools will be requiring a 14-day period of self-isolation upon return as directed by the Center for Disease Control. Again, for all of our employees and students and family who are still going, and Rocky Hanna and his wife were planning a trip next week to the Virgin Islands, and we have canceled our trip. That's how serious this epidemic is. And when you talk to people with the Center of Disease Control, we have to control the spread of this virus. Our healthcare systems cannot keep up if we have massive infections. We know that, and we all have to be a part of taking that responsibility, starting with me as superintendent. So if we have children and families and employees who are still deciding next week to go on cruises or travel internationally, you will be required to stay home for 14 days as recommended by the Center of Disease Control. If we have also several students and families who have decided to self-quarantine, we are making accommodations as a school system to still provide academic instruction to those children as needed. Self-quarantine, however, does not mean I don't come to school on Monday, Wednesday, or Good Friday. Self-quarantine means we are staying home until the situation has changed, and we will make every accommodation we possibly can. As far as field trips and athletic events, we are waiting further advice and guidance from the Florida High School Athletic Association on field trips post spring break. For right now, we have no travel advisories, domestic travel advisories or restrictions. Life will go on as normal except for the governor's order of mass gatherings of over 250 people. We will make another announcement as a school system on Wednesday, March 18th, that will address field trips and athletic activities post spring break and any other changes we need to make to adjust. But right now, our goal is, and there are not many times that I agree with Commissioner Corcoran, but we're in unison on this. Our public schools must stay open if at all possible. Now, as this situation changes, and it's very fluid, obviously, with the NBA and Major League Baseball and all these things that are going on, but our public schools must remain open and then adjust on a case-by-case basis in the weeks and months to come. Again, I'm a lifelong resident of Tallahassee and Leon County, a product of our public schools. It's an honor to serve as superintendent. I could have thought of a million different scenarios I would have faced in my first term. I don't think this was necessarily one of them or one of the board members behind me. I'd like to thank them for joining me. But again, we're all in this together and we're going to be okay. So thank you and God bless you.
Great. Alan, Mark, if you want to come join us for a couple of comments. I'd like to introduce Mark O'Brien with Tallahassee Memorial Healthcare, followed by Alan Keesee of Capital Regional Medical Center. Mark?
Hello, Mark O'Brien from Tallahassee Memorial Healthcare. TMH is here to provide care for our community. That's our principal responsibility. At the same time, it's also our responsibility to protect our colleagues. So we have been engaged in engaged with an active, comprehensive group to look at how to best care for people. We encourage people to use good common sense practices in this environment, especially considering what we're dealing with. But to address the specific concerns on how we manage care, both internal and external, we have a team that's been led by Dr. Andrea Friel, our Chief Medical Officer, Philip Doyle, our Safety Officer, and Ryan Smith, who is our Chief Clinical Officer, who is here with me today, to talk a little bit about some of the things that we're doing internal and external as we look and anticipate that first case coming into our community. So, Ryan?
Great.
Good afternoon. I'm Ryan Smith, Chief Clinical Officer at Tallahassee Memorial Healthcare. For the last several weeks, we have been pairing staff to care for these corona-type patients. As mentioned, we do not have a positive case as of yet. We are preparing in the anticipation that we will. We've been training staff. We have negative pressure rooms. We've been training them on personal protection equipment. We are setting up a site on TMH's campus to work on a screening process if a positive case occurs in Tallahassee. After that, we're quickly working with our community leaders to move that screening process to a location with our community partners off-site so we can better screen the patients in our Leon County community. Hand it over to Alan.
Yes.
Thanks. I think Alan Keesee, CEO of Capital Regional Medical Center, and just want to echo, like TMH, we're very proud to have been preparing for this, unfortunately, for the last couple of weeks. So really three things to highlight. One is access control into the hospital. Has been escalated to ensure the safety of our patients and our visitors and our physicians and our nurses and other clinical staff. We screen folks when they're entering the building so we can appropriately provide the care that they need, as well as the visitors, make sure that everyone's safe. The other point would be on supplies. As you've seen over the last weeks and months, masks, other personal protective equipment have become in short supply. But fortunately, we have 2 months of supply on hand at the hospital to ensure our readiness in case something happens in the community. And the final point would be that we're increasing our testing capability with third-party laboratories to ensure all the residents or folks that might be impacted have access to the necessary tests to ensure we can provide the clinical care appropriately. So, Lord willing, we will not encounter our first case, as we have not done so yet, but we're ready in case we do.
Great. That concludes our scheduled speakers.